giving birth, carrying a baby. It's got its challenges, particularly if it's happening under bombardments. For more on that, we're joined by France 24's Dalia Hijazi, and you've been looking at the impact that these nightly and sometimes daily bombardments have had on Lebanese women.
On Lebanese women and the displaced in general, Francois, the displaced in Lebanon are facing very difficult conditions, and this is even more so true when it comes to pregnant women who have special needs when it comes to nutrition and medical care. Now, according to a report released earlier this month by UN Women, so the UN organization or entity dedicated to women, there are over 11,000 pregnant women today in Lebanon. 4,000 amongst these women are due to deliver in the next 3 months. Several of them don't have shelter, no place to go, have seen their homes destroyed. Others actually fear not being able to deliver in a hospital due to displacement, due to maybe even a collapse of the healthcare system. And this is why in the past few weeks, there has been more and more women, pregnant women, asking or wishing to deliver prematurely. And this has been the case, so their demands have been increasing. And this has been the case with doctor or gynecologist Nicolas Ba'lini that we have spoken to, who practices in Beirut. He's encountered several of these cases. Let's hear to what he has to say about them.
As an obstetrician, I have encountered several cases of patients saying they would like to deliver. These women either have no houses or have seen their houses destroyed. Some wish to seek refuge in the mountains, wondering what to do since they are alone. What if they are left without hospitals due to the bombings? The doctors could be injured or no longer in the country. What would they do then? So I was obliged, I know other colleagues of mine too, to deliver these women in the first week of their 9th month of pregnancy, which is really an exception in my career.
Now, Francois, this same doctor has mentioned cases that are even more concerning. He says he has observed several cases recently of fetuses aged between 3 to 5 months with malformations. Now, he does not confirm, according to him, this cannot be confirmed scientifically just yet, but he questions as to whether this could be due to the air that the Lebanese people are breathing that may contain or can be carrying toxic gases from the bombs or caused by the bombs used by the Israelis. Let's listen to what he had to say about this specific point as well.
Surprisingly enough, the past days, I'm talking about the last 3 months, in 1 month, I have personally encountered 3 cases of babies with malformations in their mother's wombs, and we had to deliver them. To my surprise, as I was finding this situation strange with my patient, while talking to my colleagues, I discovered that several had encountered similar cases. One doctor with 2 cases, another with 3. In 2 months, we had at least 15 fetal deaths in the wombs of their mothers due to malformations. Not to mention early miscarriages during the first 3 months of pregnancy, etc. There has been an increase in these cases. As a doctor, I find this strange. Something is happening or has happened, and I don't have the answer to it. But with everything we inhale after a bombing, with everything being thrown at us, I am wondering if there are chemicals being released and that are playing a role in this. It's just a question I've been asking myself.
So, birth defects, women who are fearful and therefore asked to deliver prematurely, and those who have premature deliveries that are unannounced, unexpected.
Absolutely. And those cases are due to the pressure or the intensity of the bombings that cause, in turn, early contractions, which in turn cause them to deliver or go into early labor. Francois, now the case of pregnant women is just a small part of the challenges faced by the healthcare system today in Lebanon, not to mention the patients with severe illnesses that are not considered priority today because of the mounting number of injuries and who are unable to pursue their treatment regularly.
Lebanon, a country which was already under strain before this escalation. Dalia Hijazi, many thanks for that update.